Hello, everyone. Mike Mosquito along with Maureen and Eileen. I did that wrong.
You
Let's start
did
back
that
over.
wrong.
All right, one more time. Look at the
I
camera.
was like, what
One,
am
two,
I supposed
one,
to
two,
say?
three. Oh. Hello, everyone. Mike Mosquito along with Maureen.
Nylene.
We're here on location at HPN Miami 2025. We're at the wonderful Fountain Blue. We've got a guest from Philips here. Ben, tell everybody who you are.
So my name is Ben King, and I represent our enterprise sales business.
Nice.
So the entire portfolio of Philips, and we cover the largest health systems in the country. That's what my team is responsible for. Along with, I also have our GPO organization. So making sure that every part of Philips business can be available and accessible to all of our customers, and we are super excited to be the premier sponsor of HPN 2025.
I know. It's
So
been a
cool.
great event so far,
Oh, it's
hasn't
been
it?
awesome. It's
My
awesome.
gosh, the weather hasn't slowed anybody down.
Yes,
Yeah.
and we had a packed
We
room
did.
this morning for a couple of different keynotes. They're pitching Shark Tanks right now, which
Yes.
is super exciting.
Yeah.
Everybody gets like 1 minute to go and try and get as many people excited to come and visit them here in the networking room. So
Yeah.
it's super cool event.
Okay, so let me ask you, Philips, you
Mhm.
said title sponsor for HPN. Why is it important for you as Philips to be here?
Because this gives us access and gives our customers access directly to us to really kind of put away the big conference trade show style with
Right.
a booth and a lot of
Right.
formality. Now we get to have just real conversations with people, and this is where actual things happen. This is where connections get made. This is where those next meetings happen, and where people can say, you know what, I want to talk to them, regardless if it's us or anybody else. I want to talk to them to see if they can help me solve one of the many problems that I'm faced with
Absolutely.
handling.
Have you met any delegates that you had met before that you were trying to get to?
So I've met a few already. We've got a whole slew lineup of cards for meetings coming up, plus some new ones, and we're hoping that some of the Shark Tank pitches are going to really pay off for us and get us some more people. So we're super excited.
Awesome. So tell me, what is exciting at Philips right now? What are
my
you
gosh.
really proud to promote? Because you have a lot of offerings.
We do. The great thing is, based on one of the things that we just did in a keynote, is everything that we do at Philips is very clinical and patient-centric, right? So whether it be our informatics portfolio to help with remote command center operations, literally running an MRI or a CT from a remote location, that's helping with staffing challenges. Our remote telemetry, our remote command centers for monitoring, there's a big shortage in nurses. Everybody knows it, right? So how can we help enable more people being monitored with less staffing and having that oversight, kind of the over the shoulder piece, so that way a frontline nurse can actually just spend time with the patient and their family, which that human connection is what we're really looking for.
I love
And
that.
that's what, as a patient myself, I have family members who are patients, of course. I want to talk to a human. I want to see them face to face, and I want to know that they're paying attention to me instead of having to document and chart and everything like that. So having that over-the-shoulder watch is a huge comfort to the staff on site, because they can get to do what they want to do and what they're trained to do. So there's everything from radiology, AI enablement to help radiologists read more, read faster, be able to see things that maybe their naked eye just wouldn't pick up. And then our whole patient monitoring portfolio, and then of course our interventional suites, so cath labs, hybrid labs, IR labs, all the whole slew of interventional tools overlaid with our informatics portfolio just helps with maybe seeing more patients a day, or just preventing people from having to work overtime, whether it's a staff satisfaction thing and you can get another patient and you can do one more case, meaning more revenue, or you don't have to keep them in the lab longer than they need to be. They can go and be with their family. They're happier. They come back refreshed, ready to handle the patients the next day.
Win.
I know, right?
I like that.
That's a lot going on.
I know.
Well, thank you very much for joining us. The buzz here is on site to take these notes forward. We want folks like you to keep showing up at these conferences. It's important to have you here, showcasing these solutions that the other CIOs need to learn about. I think it's hard for a sitting CDIO or a CIO to sit in their space and learn about all the solutions that are in this room. So it's important for them to come here and meet folks like you, Ben. So thank you very much for showing up.
Well, we're excited to sponsor. Thank you very much for this time. I appreciate it.
We're excited
Super cool.
to have you.
I loved the podcast yesterday, so I'm gonna keep watching those. So thank you very much. Thanks for this opportunity, and it's great to be with you.
Well, thank you very much, Ben. We look forward to seeing you on the floor and see what Phillips has got going on this year.
Awesome. Sounds
All right.
great. Thank
you very much. And for you, keep subscribing and liking what we're doing here online at the Buzz Podcast. You can find us on thebuzzpodcast.net or any of your social media channels. And until next time, keep buzzing.